Endometriosis is a common gynecological disorder defined by the proliferation of endometrial glands and stroma outside the confines of uterine cavity. Peritoneal endometriosis is believed to be the result of implantation of retrogradely shed endometrium during menstruation, which has the capacity to adhere, attach and implant ectopically. Survival of endometriotic lesions is crucially dependent on the establishment of an adequate blood supply. Angiogenesis is the process of development of new blood vessels from the pre-existing ones and is a dynamic process involving many factors. The endometrium has angiogenic potential, and endometriotic lesions grow in areas with rich vascularization, suggesting that angiogenesis is a prerequisite for endometriosis development. Vascular endothelial growth factor (VEGF) is considered to play a pivotal role in both physiologic and pathologic angiogenesis. Vascular endothelial growth factor concentrations were found to be particularly high in endometriomas. The most potent stimulus for the upregulation of VEGF is hypoxia. VEGF secretion from hypoxia-exposed endometrial, stromal and glandular cell cultures markedly increases. High concentrations of soluble VEGF accumulates in the pelvic fluid in patients with endometriosis. A positive correlation has been found between the severity of the disease and the secretion of VEGF. Binding of VEGF to its type 2 receptor appears to be the main regulator of angiogenesis. Anti-angiogenic therapy has been proposed as a promising strategy for several angiogenic diseases, including endometriosis. Inhibition of angiogenesis by targeting VEGF results in inhibition of endometriosis. Administration of dopamine receptor 2 agonists simultaneously blocks angiogenesis by interfering with VEGF receptor 2 signaling. Carbergoline, by the activation of the dopamine receptor 2, promotes VEGF receptor 2 endocytosis in endothelial cells, thus preventing the VEGF receptor 2 binding and subsequent angiogenesis. Carbergoline was compared with LH-RH agonist for treatment of endometriosis in a randomized controlled trial. After treatment of 3 months, Carbergoline was found to be significantly effective than LH-RH agonist. Carbergoline reduced endometrioma size significantly in 65% of patients. Carbergoline reduces endometriosis-associated pelvic pain by reduction in nerve fiber density. It was concluded Carbergoline can be tried as first-line treatment for endometriosis.